Welcome back to Black News Tonight. Sickle cell anemia is a disease that impacts black people the most in the United States. Here are some stats to help us get a better picture of what's going on here. According to CDC data, about 100,000 people in the U.S. have the disease, and most are of African descent. It occurs among 1 in every 365 African American births. And every 1 in 13 black child is born with the sickle cell trait. Joining me now to discuss this is Dr. Yvette Miller. She's the Executive Medical Officer at the American Red Cross and their Client Donor Support Center. I also have with me Nicklaine Paul. She's the founder of Sickle Cell Care Solutions. Welcome, both of you, to Black News Tonight. Dr. Miller, I'm going to start with you. I just ran through some basic numbers on the screen, but can you give us a more detailed picture about what the disease is and why African Americans are affected the most?
So thank you so much for the opportunity to share this information. And as you mentioned, about 100,000 individuals in this country have sickle cell disease, most of whom are African American or of African descent. So the primary treatment for sickle cell disease is blood transfusion. And as African Americans, we have some unique antigens on our red blood cells that must be closely matched between the donor and the recipient. So in many cases, the most compatible blood match is between an African-American donor and the African-American patient.
That's so important. Nicklaine, you are a sickle cell disease patient yourself. Can you give me a picture of what it's like, what it means to live with sickle cell?
Sure. It's an honor to be here, and it's really hard to express truly, but I will say that the disease holds a very unpredictable factor. You, from a very young age, being born with sickle cell disease, you get to know your triggers and what really to avoid to the best of your ability. But again, it's a very debilitating pain can happen based on your triggers, and you try to avoid it again. But the crisis pain, the best description I can say that's closest to what I can resonate with is it's a rainstorm of daggers on your bones. It's a debilitating, severe pain that is really internal. It can hit at any time, anywhere, and it's a really sharp, dull, consistent throbbing. So it's hard to really say what we live with on a day-to-day basis, but you can live a healthy, full life with the right care and the right support, but it is much like a rainstorm of daggers.
Wow. When were you first diagnosed?
Yes, I was actually born in Haiti, and I was diagnosed at the age of 2 with a blood test. So my mom is a nurse, and so she had some medical background, and so that helped in ways. And so from there, we knew, because my dad is a carrier, and so is my mom, they knew the possibility because of the awareness. And so I was diagnosed at a very young age in Haiti.
Okay. It's very important. And Dr. Miller, that's also something to think about, you know, when people are doing genetic testing, when people are thinking about family planning, child, planning, etc., to know whether or not you are a carrier. For example, I'm a carrier of the sickle cell trait, and so that's something that you have to think about, right?
Yeah, absolutely. It's a really important piece of information. And again, only since 2006 has it been mandatory that every newborn born in this country be screened for sickle cell trait. But we have generations of individuals who have no idea what their sickle cell trait status is because we don't track that. We didn't track that then, we track it now. So the work that we're doing at the Red Cross is that individuals who self-identify as African American, we are performing sickle cell trait testing. And we're focusing on African Americans, again, because the majority of individuals in this country who have sickle cell disease are African American.
So talk to me about, given that reality, how important donating blood is for black people in particular, because some folk out there are going to say, well, look, if white people got that blood type, why can't they donate it? We all bleed red. What's the difference?
Well, as I already mentioned, there are some unique structures on the red blood cells of individuals who are of African descent that have to be matched between the donor and the recipient, specifically in the case of patients with sickle cell disease. Patients with sickle cell disease can require hundreds of units of blood in a single year. So you can see how exponentially that number of units grows as we try to treat thousands and thousands of patients with sickle cell disease across this country. So that's why it's important for African Americans and those of African descent to donate blood. It's our community responsibility to stand in the gap and meet the transfusion needs of this population of patients, which are primarily African American of African descent.
How successful are we in our blood donation efforts, or the attempt to get people to donate? I mean, are Black people equally likely as other Americans to donate? Are they less likely? Are they more likely? Where do we stand on that?
Only about 4% of blood donors are African American. And of course, you know, we make up about 12 to 13% of the population. And so you can see what the struggle is to meet the transfusion needs of patients with sickle cell disease, the thousands of units that we need donated a year by that very small population of donors. And so again, that's why it's incredibly important for African Americans to donate blood to meet our community needs to support these patients with sickle cell disease. So it's incredibly important.
That's a great conversation to have, Doctor, you know, is to say, look, Black folk, we need to donate blood because it's the right thing to do, but we're also giving it to us. It's for our community. This isn't just a sort of general American thing, although there's an argument to be made about just helping any human being. But this is our community that has these intense needs, and so we have to do something about it. Nicklaine, you've devoted your life to this, right? You know, you are a registered nurse. You treat patients with the sickle cell disease. Talk to me about what it means to do this kind of work, and sort of what you've seen, the difference in people's lives you've seen when blood transfusions are possible.
Definitely. Again, being born with sickle cell disease, I do have what's considered the most common, most severe case. It's sickle cell SS, but I do have persistent fetal hemoglobin, which is your baby hemoglobin, which shortly, about 6 months to a year, is replaced with adult hemoglobin, which holds on to oxygen a little less. And so therefore, the manifestations of sickle cell disease come about when you age, right? And so for me, it's important to understand that I personally, blood donations is so important. I was 5 years old when I actually received a life-saving transfusion. And so being on the other side of the fence as a healthcare professional, I really wanted to make this the cornerstone. I knew from a very young age I was going to be a nurse specifically for sickle cell, because to see someone come in excruciating, debilitating pain that really they're unable to treat themselves necessarily at home after all the measures they've implemented, and to now be able to see what you as a healthcare, as a registered nurse, can do in a day to really help alleviate that pain. But on a more broad spectrum, the education and the awareness is so key. I think it's so important to educate all the public and healthcare professionals to really understand not only the medical complications, but also the personal effect that it has. We have sickle cell doesn't have us. And so it was really my mission, my life's work, my passion. Mm-hmm.
No, I was just saying, I like that idea that I have sickle cell. Sickle cell doesn't have me. You know, I have family members, a niece, and other people who have sickle cell, and watching them deal with it from a very, small age, when they're in crisis, when they're having extraordinary pain, it's very challenging to watch. And so everything that I'm seeing you do to advocate for other people as you're dealing with this yourself, it's so important. And Dr. Miller, what the Red Cross is doing is important every day of the year, but I want you to talk a little bit specifically about what's happening this September, as it is, of course, Sickle Cell Awareness Month.
So again, as you mentioned, September is Sickle Cell Awareness Month, and we have a campaign that was launched on the 14th to really focus resources and information and education to the African American community. We completely underestimate how much people understand about sickle cell disease. And so lack of education is really significant. So we have all of this information. We are using social media. We are on, TV spots like being on your show tonight. So thank you so much to get that information out and using influencers to really communicate that information about how important it is for African Americans to donate blood to support patients with sickle cell disease.
Well, we certainly see it as important, and here at Black News Tonight we'll continue to cover this as we do throughout Black News Channel as a network. Yvette Miller, Nicklaine Paul, thank you both for joining me and for offering such important and informative commentary. Everybody, if you want to learn more about sickle cell disease and how you can donate blood, please visit redcrossblood.org/ourblood.